Hello everyone, I'm Dr. Joseph, and welcome to my channel. Did you know that 1 in 4 people over 50 are living with diabetes without even know? Diabetes does not suddenly arise. Before it sets in once and for all, the body begins to send 10 silent, almost invisible signs that often go unnoticed, even by doctors. And that's exactly where danger lives. Ignoring these signs can be the initial step for a future full of serious complications, such as vision loss, kidney failure, amputations, and even fatal heart problems. Just imagine, you live your routine normally, without realizing that something so silent and dangerous is happening inside your body. A constant tiredness that you blame for age, excessive thirst that you think is dehydration, or even small changes in the skin that seem insignificant. These signs are like a rescue request from your body, but most people only realize when it's too late, when diabetes is already installed and complications begin to emerge. But here is what no one tells you. If you identify these 10 signals in time, it is still possible to act. You can still reverse the prediabetes, recover your health, and prevent this silent disease from dominating your life. Think about what this means. Avoid years of drug addiction. Avoid insulin bites every day, and, especially, avoid the risk of serious complications that can steal your quality of life. In today's video, I will reveal you the 10 silent signs of prediabetes that many people ignore, and how you can start fighting them right now. This may be your last chance to act before it's too late. Do not let the fear of knowing how to become regret in the future. Your health and freedom depend on it. Well friends, prediabetes can be reversed, and that is why today we will present the 10 most common signs of this condition for everyone to know them. In the end, we will also share 8 simple and essential habits to keep diabetes well over your life. So let's go to the point. Signal number 1. Constant fatigue. Do you feel you are always tired even after a good night's sleep or a day of rest? This type of tiredness is not normal, especially when even simple tasks seem exhausting, as if each movement required huge effort. This exhaustion can be more than just age. In people with prediabetes, this tiredness occurs because the body cannot use blood sugar as a source of energy. The fuel that should feed your cells gets stuck in the blood, while your cells literally starve. The result? You feel without energy, as if you have been carrying an invisible weight all day. Your mind also pays the price. Concentration disappears. Reasoning is slow, and even your mood is affected. If you are living this, don't ignore it. This may be one of the first signs that something most serious is happening in your body. Signal number 2. Constant thirst. Feeling in hot days or after intense activities is normal. But the problem arises when, even at mild or without physical effort, you feel an incessant need to drink water, even though you have already consumed the recommended amount throughout the day. In cases of prediabetes, this constant thirst is caused by excess blood sugar. Overwhelming kidneys need to work bent to filter and eliminate this sugar, which causes the body to lose more water than it should. This dehydrates you from the inside out, generating a sensation of dry mouth and continuous thirst, which simply does not disappear, no matter how much you drink. Although it seems something harmless, this persistent thirst may be a warning sign that your blood sugar levels are above normal. Ignoring this may mean leaving a serious problem getting worse silently. Signal number 3. Slow healing. Under normal conditions, a surface cut begins to heal between 3 and 7 days, and within 2 weeks, is completely closed. But if you have prediabetes, the body healing process doesn't work as it should. Even small cuts or scratches can take much longer to heal. This is because excess blood sugar impairs circulation, making it difficult to transport nutrients and oxygen to the injured area, elements essential for tissue regeneration. In addition, the immune system is weakened, making your body more vulnerable to infections. Small wounds that should be resolved quickly can remain open, inflamed, and even get worse over the weeks. Although many people do not realize, this is one of the most dangerous silent signs of prediabetes. What seems like a simple delay in healing can be a clear warning that something is unbalanced in your body. Ignoring this can be expensive. Signal number 4. Frequent urination. Do you feel you are going to the bathroom more often than usual? This is one of the most common and often ignored signs of prediabetes and blood glucose levels, and that doesn't happen just during the day. For many people, it is common to wake up several times at night to urinate, damaging sleep and, consequently, its quality of life. In addition, the urine is usually clearer as you feel the need to drink more water to compensate for dehydration caused by excessive loss of fluids. This continuous cycle of drinking water and urinating the kidneys, overloading them, putting them under huge effort, and over time this can compromise its renal function. But here is an important question. Do you remember what was the result of your last fasting glucose exam? If you don't remember or are in doubt, be aware. These signs may be the first warning that your body is fighting a dangerous imbalance. Stay with me until the end to find out more signals and understand if your body is at the limit or at risk. Every detail can make a difference to protect your health. Signal number 5. Blurred vision. Have you ever had the feeling of seeing the world as if looking through a blurry glass? This fog effect on vision may seem only eye tiredness, but it is, in fact, one of the most common and underestimated signs of pre-diabetes. When blood sugar levels are high, they interfere with the structure of their eyes, temporarily altering their shape. This directly affects the way you see, leaving the vision blurred suddenly. Simple activities such as reading labels, moving your phone, or watching TV can become challenging. What makes this symptom even more treacherous is that it can come and go, creating the false impression that it is nothing serious. However, this silent warning is the way your body says something is out of balance, and your vision is just the beginning. Do not ignore this warning. If you realize that your vision has unexplainable moments of turbidity, it's time to pay attention to what is happening inside your body before something more serious happens. Signal number 6. Increased appetite. Do you feel hungry often, even a short time after eating? This sign, which is often associated with stress or rush of everyday life, may be a warning that something more serious is happening in your body. In prediabetes, even with high blood sugar levels, their cells cannot absorb glucose due to insulin resistance. The result, an appetite that suddenly arises, seems insatiable, and often leads to excessive consumption. The problem is that this exaggerated consumption, besides causing weight gain, creates a vicious cycle. Increased weight intensifies insulin resistance, which further aggravates prediabetes and accelerates the way to type 2 diabetes. This mechanism often goes unnoticed because it is easy to blame intense hunger for tiredness, stress, or even age. But if you have felt this kind of unusual hunger, it's time to look more closely at your health. It may be your body trying to warn that something is not right. Sign number 7. Dark spots on the skin. Have you noticed dark spots or thicker skin areas, especially in frictional regions such as neck, armpits, groin, or even fingers? These points, known as acanthus nigricans, can be a silent sign of insulin resistance. One of the main indications of prediabetes. These skin changes happen because excess blood insulin stimulates abnormal growth of skin cells and increased melanin production, the pigment that gives your skin color. The result is dark and velvety spots that can form on the folds of the body. Although these spots are not painful, they can cause significant aesthetic discomfort. In some cases, even itching or light irritation may arise. Many people tend to ignore these signs by attributing them to simple skin irritation or dryness. However, what many do not know is that these dark spots are a warning of your body, indicating that metabolism is unregulated and that insulin resistance is settling. Ignoring these signs may mean losing the opportunity to act before insulin resistance evolves to type 2 diabetes. If you notice these blemishes, be sure to seek medical advice. Your skin may be trying to count something much more serious. Signal number 8. Tingling or dormancy in the limbs. Have you ever felt like tingling, numbness, or even a pin in your hands or feet, especially after long rest periods or after physical activities? These symptoms can be signs of peripheral neuropathy, a common condition in people with high blood sugar levels. When excess blood sugar damages small blood vessels that irrigate the nerves, especially at the extremities, the supply of oxygen and nutrients to the nerves is compromised. The result is a feeling of tingling, numbness, or even a feeling of bites, which may seem small or occasional at the beginning, but over time, become more frequent and intense. Although these symptoms may seem harmless at first, if untreated, they can evolve and affect balance, sensitivity, and quality of life. The progression of peripheral neuropathy can make activities simple, such as walking, touching objects, or even dressing, extremely challenging. Do not ignore these sensations. If you are experiencing this tingling or numbness, it is essential to seek medical help. This symptom may be a sign that your body is warning you about something more serious, and acting early can avoid greater nerve damage. Sign number 9. Frequent infections. Have you noticed recurring infections that just don't disappear? In people with prediabetes, these infections may be a clear sign that the body is facing a critical imbalance. With high levels of blood sugar, the immune system is weakened, making the body more susceptible to the excessive growth of bacteria and fungi. Repetitive urinary infections, persistent skin irritations, or frequent episodes of candidiasis are some of the signs that your body is having difficulty protecting yourself. This environment, favorable to the growth of microorganisms, is powered by excess glucose, which compromises its natural defenses and facilitates the spread of infections. If you are constantly dealing with these infections that do not seem to improve, it should not be ignored. Insulin resistance, characteristic of prediabetes, may be the underlying cause, and it is essential that you seek medical advice as soon as possible. The sooner you identify and treat the cause, the easier it will be to avoid future complications. Signal number 10. Hormonal changes. Have you noticed inexplicable changes in your body, such as unregulated menstrual cycles, increased facial or body hair, persistent acne, or symptoms similar to those of polycystic ovary syndrome? In women, these changes may be signs that something is wrong with hormonal balance, often related to insulin resistance, characteristic of prediabetes. In men, the situation is equally worrying. Falling testosterone levels, an essential hormone for male health, can result in symptoms such as decreased libido, extreme tiredness, and even erection difficulties. In addition, for both men and women, abdominal fat accumulation is common. Because hormonal deregulation directly affects the way the body stores fat, these hormonal signs are often neglected or confused with aging or stress, but may be a crucial warning that prediabetes is beginning to affect your body. It is important to remember that each person can experience these symptoms differently, but all are indicators of a possible metabolic imbalance. If you are experiencing any of these hormonal changes, do not ignore the signs. Consulting a healthcare professional is essential to assess whether insulin resistance or other factors are at stake, helping to prevent future complications and keep your body in balance. So if you have questions, we recommend that you go to a doctor to perform all the necessary exams. Speaking of exams, what are the normal values of blood sugar? If you have this doubt, here we will clarify once and for all. According to the latest medical guidelines, fasting glucose levels measured after a fast of 8 hours below 100 milligrams per deciliter are considered normal, indicating glucose within healthy parameters. Values between 100 and 125 milligrams per deciliter indicate prediabetes, also known as altered fasting glucose, which indicates a high risk of developing type 2 diabetes and associated complications. Values equal to or greater than 126 milligrams per deciliter, confirmed on more than one occasion, are diagnoses of diabetes, which requires immediate medical care for their management and prevention of complications. And what do you think? Are you healthy, pre-diabetic, or diabetic? Regardless of your current state, the good news is that there are 8 simple habits that can keep diabetes away from your life or help it control it if you already have it. So come on. These are the habits you need to have. A balanced diet is the basis for preventing prediabetes and diabetes. Prioritize the consumption of fiber, rich foods such as apple fruits, pear, red fruits, broccoli, vegetables, spinach, carrots, oat cereals, quinoa, brown rice, and legumes, beans, lentils, grain levels. Reduce foods with simple carbohydrates such as white bread, sweets, soda, and processed juices that generate glucose peaks. Healthy fats present in olive oil, avocado, and omega-rich fish are fundamental to combating inflammation and improving insulin sensitivity. Be preference for healthy cooking methods such as baking, cooking, or baking, and avoid fried foods rich in sodium and chemical additives. The number 2 habit is the practice of regular physical activity. Exercise practice improves insulin sensitivity, reduces blood glucose levels, and helps to control weight. Kava factors to prevent diabetes. Aerobic activities such as fast walking, running, swimming, or cycling are ideal for burning calories and improving cardiovascular health. Resistance exercises, such as weightlifting, help to develop muscle mass, which is metabolically active and improves the absorption of glucose by cells. To maximize the benefits, 150 minutes of moderate activity per week, distributed in daily sessions of 30 minutes. The number 3 habit is to maintain healthy body weight, especially accumulated visceral fat in the abdominal zone, which is one of the main risk factors for insulin resistance. Even a minimal body weight reduction of about 5% can significantly improve glucose metabolism and reduce the risk of progression from type 2 diabetes. To achieve and keep healthy, combine a balanced diet with a regular exercise plan. Control parts of your meals and avoid eating for distraction or stress. The next habit is stress and habits control. Chronic stress increases cortisol levels, which can lead to a persistent elevation of blood glucose levels and affect insulin sensitivity. In addition, stress usually triggers harmful behaviors such as overeating or avoiding physical activity. Relaxation techniques such as meditation, yoga, or walking in contact with nature help reduce cortisol levels and promote mental balance. Another effective strategy is to better organize daily tasks to avoid overloads, including regular rest breaks. The number 5 habit is to sleep properly. Sleep quality plays a crucial role in regulating glucose metabolism. During deep sleep, the body performs important processes, such as maintaining insulin sensitivity and regulating hormones. Sleeping less than 7 hours a night or having a low-quality dream can increase insulin resistance and stimulate appetite, favoring the consumption of foods rich in calories and carbohydrates. To improve sleep, avoid the use of -2H electronic devices before bed. Keep the atmosphere dark and silent, and set a routine of sleeping and awakening schedules. Also, avoid caffeine drinks at night, 1,000 and heavy meals before bed to ensure a more repairing sleep. The 6th habit is to avoid excessive alcohol consumption, and excessive alcohol consumption to smoke can deregulate blood glucose levels, causing hyperglycemia and hypoglycemia and contributes to weight gain and inflammation in the body. On the other hand, smoking is associated with insulin resistance, chronic inflammation, and greater risk of cardiovascular complications. To avoid these effects, it limits alcohol consumption to moderate levels and seeking support to quit smoking, such as cognitive behavioral therapy or nicotine substitutes if necessary. Leaving these habits not only reduces the risk of prediabetes, but also significantly improves overall health. The number 7 habit is to drink water. Drinking sufficient water during the day is essential for the ideal functioning of the body and to maintain healthy blood glucose levels. Dehydration can increase blood glucose concentration, making it difficult to control. It is recommended to consume approximately 30 milliliters of water per kilogram of weight per day, although this amount may vary according to factors such as the level of physical activity and weather conditions. Avoid replacing water with sugary or industrialized drinks, such as soda and packaged juices, as they may increase the risk of insulin resistance. The number 8 habit is to regularly monitor metabolic health. People with risk factors such as family history of diabetes, overweight, or age of over 45 years should be performed in fasting glucose and regularly glycoside hemoglobin, as indicated by the doctor. These tests allow you to identify early changes and allow interventions before the condition evolves to type 2 diabetes. In addition, medical monitoring may include blood pressure assessments and renal function tests, ensuring a comprehensive preventive approach. Friends, if they came here, is because probably, like me, you want to keep diabetes away from their lives, right? Then click on the video that appears on the screen to find out more about improving your health. Thank you so much for your attention, and God bless you.